Good afternoon, everyone. I hope we're all doing well today. Just give it another minute or so just to let people join in. I'm sure there's many people finishing one meeting and joining another one straight away if it's anything like my diaries. So just going to give it a few more minutes, but whilst I do that, I will just very quickly run over some housekeeping rules. So just to let everyone know that this webinar will be recorded, and that's for those who are either unable to make it today or want to come back and revisit the session, can able to do so at any point with a recording link. We will send this as well as a copy of the slides and any further materials to you via email within 24 to 48 hours after the session concludes today. So you will have a copy of everything. You don't need to opt in for that because you've already all registered. Just want to let people know as well that whilst the presentation is happening, we would ask if everyone can just remain on mute. That's so that we can make sure we can hear Sam and Martin clearly. But then when we go into a Q&A section after the main presentation, it'd be really helpful just if you could either use the raise hand function to invite yourself off of mute and then ask your question to the presenters. Or if you'd like to just drop your questions within the chat, I'll be facilitating just to make sure all the questions are answered. I'll also put my email into the chat as well in case you'd like to ask anything anonymously. So we'll have all bases sorted. Sonam, I'll just ask if you can quickly just monitor the lobby and let people in as and when they apply to do so. However, before we go into the main presentation with the National Dementia Care Accreditation Scheme, I just want to hand over to Martin Green very quickly.
Thank you very much, Fraser, and good afternoon, everybody. And I'm delighted to be involved in this seminar, not only in my role as the Chief Executive of Care England, but also in my role as the Independent Sector Dementia Champion at the Department of Health. Now, I think all of you will know that dementia is one of the biggest challenges for the social care sector, and between 70 and 80% of people who are living in care services have some form of dementia. What's been disappointing is that because there was a lot of progress in dementia care over the last 10 to 15 years, we thought that we were on a trajectory that was going to certainly move the agenda forward. But sadly, the current government has taken the diagnosis targets away from dementia. So this means a lot of people are living with dementia, but they don't have a diagnosis. And I think we should also acknowledge that there are many forms of dementia and they all manifest themselves in different ways. So that's why diagnosis is important. Having said that, I think the care sector has really shown itself to be in the vanguard of delivering the best quality care for people living with dementia. And some of the best care I've seen has been in the social care sector. But often one of our challenges is we don't really know how to quantify that. And we also don't know how to benchmark the quality of our care with others. And that's why I'm really delighted that we're working with the National Dementia Care Accreditation Scheme and Sam Dondi-Smith to look at the whole issue of how we accredit dementia care services so that people can be really clear and assured that their services are of good quality, and also how they can be benchmarked against others. What I really like about this, and I think it's testament to Sam's experience in this area, is that this accreditation scheme is really practical and it gives people some very clear practical ways in which they can show the quality of their dementia care, and also through the association with the scheme and see how other people are meeting this challenge. So on all those levels, I think today's seminar is going to be really useful to everybody who is supporting somebody living with dementia in a care service. And I've known Sam for a while and have great respect for your work, Sam. So we're really looking forward to hearing what you have to say in this seminar and how you will go through telling us about the scheme and how it works in practice. So I'm now going to thank everybody for attending and hand over to Sam.
Thank you, Martin. That's a lovely introduction. Thanks so much. I want to make sure before I start just that everybody that's on the call, I'm hoping is working in for or with people living with dementia. Our particular experience of working with providers this year has been working in care homes. We've worked with about 100 providers. Not all of those have got to the state of becoming accredited, but the hopefully the value you will get from this session, and it says it in the title of the session, is that it's practical steps to make a difference and to transform your dementia care. So whilst I'm always happy to talk about the accreditation scheme proper, really for me, the purpose of being on this call with you is to give you practical guidance and real kind of delivery, hopefully of value, so you can be making some positive change in your services. As Martin said, 70% plus of people moving into care homes are living with dementia, and so it's very, very important that we ourselves as care providers are well versed in how to support those individuals. I'm just gonna, oh, here we go, it's working now. Our methodology as the National Dementia Care Accreditation Scheme is working with providers to improve the delivery of care for people living with dementia. Yes, as Martin explained beautifully, we are about supporting providers and benchmarking them against our standards, of which we have 140 of them. The area that I want to talk about today, I want to go through each of the pillars of exceptional dementia care that we benchmark a service against. And the information that I want to talk through with you has come about the assessments and the visiting of the services we've done in 2025, and the common areas of development. And so, like I've kind of said, I want to keep reinforcing to you, is that I want you to go away with value and positive change. I'm a great believer in the number 3, and so I know that a lot of people will hopefully be scribbling down lots of information about the interventions and support that we would be recommending. But I would urge you, if you can, if you support people living with dementia, just take away 3 things from what I'm about to say, and make some positive change for your service. That's exactly what I'm here to do, is to try and provide you with as much value as possible. So I'm going to break down each of the 9 pillars that we benchmark a home against. And I want to talk through not everything, because like I say, there's 140 standards that we do benchmark a provider against, and those standards are really around and the consideration of those standards for us as an organization is really about whether an intervention does really improve the lived experience of people living with dementia in that setting, whether there's credible evidence, research, practice-based outcomes, or lived experience that really shows that these interventions genuinely work, whether they're safe and ethical, and that they align with legislation and other national frameworks. And also, obviously, a really important area for a lot of providers is, can this intervention be realistically and consistently delivered without excessive cost, burden, or complexity? So this is very important for us. Whilst there are lots of things you can do and technologies that you can purchase that can support people living with dementia, there are many things that you can do that are that only cost your time in implementing. And whilst we all value our own time and other people's time, I think the investment that you can make on some very simple things that I will go through today will really make a difference to people's lived experience. So this is really important for me personally and professionally as an occupational therapist, and hopefully what I'm going to be talking about next is really adding value to your service. Okay, we're going to get straight to it, because there's a lot of information, and like I say, I want to make sure that you're going away today with with as much value as possible. And really all these areas that I want to discuss today have come about from the assessments that we have provided. So our case managers that go in and benchmark homes on those 140 standards, and these are common areas of development for providers. The first pillar is called knowledge and understanding of dementia care. So this is really about how a service understands how dementia affects each person individually. And one of the models that we look at, which is commonly known in the research and the kind of expert community, but not so well known in practice, is called the enriched model of dementia. And so if you can look up the enriched model of dementia, it helps, and you can support your team to understand it. It helps you and your team to understand how dementia can affect people differently in terms of their personality, their biography, their physical health, their neurological impairment, and their social psychology. We, as an organization, and myself, passionately believe that dementia care is very different from dementia, the disease, in that dementia is about how the disease affects the brain, whereas dementia care is around how it affects a person individually and how you can then support them once you know more information about them. So the knowledge, the understanding of the person is very, very critical in this area and the next as well. I'll talk a little bit more about that in a bit more detail in a second. The second area within this pillar, knowledge and understanding of dementia care, is what I would call lived experience. Now, when we visit homes and we benchmark them, we understand how a provider is supporting people living with dementia. We try to get an understanding of what people's lived experience is. And people living with dementia sometimes have in fact, everybody has a different experience of life, and everybody within a care setting has a different experience of their environment and the people around them. And people living with dementia are no different, even though they may have a cognitive impairment and psychological symptoms that go alongside that. So people's lived experience is really, really important. And there's some great training resources online and on YouTube. Again, low cost or no cost, and I'll say some more YouTube channels a bit later on. But understanding lived experience and understanding how people experience the world differently with dementia is very, very important. There is some specific training you can go on around understanding lived experience and how people experience the world. But one of the areas that is really, really important in this section is how do you understand and interpret people's lived experience? And from our point of view and our understanding, the best way to do that is through what's called qualitative observations. I'll talk to you a little bit more about that a bit later on and some resources that you can access. The next area, which is really important within this pillar, sorry, drawing up a bit there, is understanding communication. Very, very important, but there are some fantastic training programs out there around communication, but there's some very, very simple things that people can be doing in terms of their verbal and their non-verbal communication skills about, and that's around connection. How do we connect with people? And importantly, this is more important to focus on the non-verbal means of communication as people progress with their dementia. So when we're understanding knowledge when we're trying to benchmark knowledge and understanding of dementia care, we're really focusing on how does the team have a good understanding and interpretation of people's lived experience, and also how do they understand each person's dementia, and whether they understand what we would call the enriched model of dementia. So if you can look that up, it's something that has been put together by Tom Kitwood, developed by Dawn Brooker and others, and a very, very great book to, I've got a few books in my little pile here to suggest, is Person-Centered Dementia Care, and this is by a lady called Dawn Brooker and Isabel Latham. The second pillar, this is easier said than done, but this is very, very important, particularly when people are moving into a care home, or moving into any type of support organization, care home or home care. Information about the person is so critical, so important, that when each person moves in with you, obviously as part of the regulatory requirements, you're required to collect information about that person. But when we're talking about information about the person in this context, it's about the psychological, the social, and the occupational. Now, what I mean by that is what makes that person up as a person. How do we understand them as an individual? What makes them tick? Hobbies, interests, what type of things were they doing before they came into your services? And that helps you then maintain how you can keep people connected to outside communities. So when we're assessing a home or understanding a provider, we're really focusing on how do you collect information about that person, not just their health needs, not just their diagnosis, but them as an individual. And this is, like I say, it is easier said than done, particularly when people are moving from hospital to care home, and particularly if people don't have family that can help support this, if they're not able to communicate. But this is, there are ways of trying to find some of this, what I would call psychosocial, so psychological and social and occupational information about a person. Again, see how they interact with people, see how they observe them, to see how they are with different with different activities. How do they interact with people? It helps once you understand what makes somebody tick and really what makes them up as an individual, particularly understanding their biography and their background. We can really get a sense, and we can really get to start understanding why they may present in certain ways, why they may be communicating in certain ways. Understanding that person's background, their biography is critical to try and unpick areas, particularly if people are less able to communicate verbally their needs. The next area on information about the person is understanding someone's cognitive and social functioning. Now, often providers will collect a diagnosis, but they won't always be collecting how someone can function socially, cognitively, and occupationally. Now, from my point of view as an occupational therapist, this is about what can that person do when they're moving into your service. And the important part and the rationale and the reason why you would collect that information is to try and maintain their independence as you support them. And this can be done in a number of ways. Sometimes you can get an understanding from families, sometimes you can get an understanding from the person themselves, but to understand how they can engage with the environment and how they can engage in their own self-care, their own leisure, their own productive activities. This is so important for providers to understand, so they don't you don't then provide them just with what I would call more generic activities. It can be more person focused, it can be more person led when you're trying to prescribe and write care plans that are focused on meaningful participation and meaningful occupation. The final part on information about the person is a tool that can be particularly useful for people who can get distressed on a regular basis and who are increasingly complex over time, is using something like a traffic light support plan. So this is a very easy to use visual guide for team members to understand how to support that person when they're well, how to support that person when they are becoming distressed, and how to support that person when they are distressed. This is something that we see quite a lot, is that providers may have something written in a care plan that can be, fairly deep within that person's care plan around practical steps to support that individual when they become distressed. And because they are often quite deep within someone's care plan, they're not always read by team members. And to put something together for people who live with distress, such as a traffic light support plan, this can be really helpful for new team members, for team members who are working from an agency, might not know that person so well. And also for visiting professionals and families. How do we support this person who is living with distress? If there's an easy to use guide, such as a traffic light support plan, then that can be something that can be put in place for people and used as a preventative intervention to support that person and particularly new members of the team. Okay. Pillar 3. So this is 3 of 9. Person-centered participation and engagement. So this is something that I'm very passionate about, and is particularly pertinent post-COVID. I've found when visiting homes, is that participation and engagement for people living with dementia in your service is absolutely critical. There are a number of things that you can be doing to enhance this, and the most common that I see and our case managers see is a lack of engagement materials or resources in people's living space. So again, a lot post COVID, obviously there was everybody had to be very tight, very clean for obvious reasons, and sometimes things are put away because they're seen as kind of a mess, or they're seen as an infection control risk. The risk on the other side of the coin, and something that we do see quite frequently, is that people can be sat in living spaces or are walking in living spaces, and there's nothing out for them to engage with. So this can be simple things like magazines. It can be items that are specific to them, so things that are that will allow them and the team to connect with the world around them. So resources that are out, resources that are available, suitable, ideally person-centered, so are not kind of they're not infantile, childlike kind of toys or anything like that. They're more focused on the people that are living in that space and are available to them. So that's something that is really important, and again is something that hopefully people that are on this webinar can take away. And when you go out into your living space, please go into the room where people are spending a lot of their day, and just see if they have things accessible to them. Do they have things that they can reach, that they can fidget with, that they can feel, that they can interact with, that they can engage with? It's a very, very simple, it's a very easy way to suddenly increase the levels of engagement for people living with dementia in your setting. I can hear someone on the train. I think everybody needs to mute. I can hear some train stations on the webinar. Everybody mute that's on the call. The next area, again, it's focused on engagement, focused on participation, is the team's understanding of what is called grading and adapting. And grading an activity is around making something easier to reduce its complexity, and adapting is around using different resources around you to make a task more manageable for somebody. So something that we do see quite a lot is activities going on, but they're going on for, I'll give you an example, something like a quiz as a group activity, people gathered round, and the team not necessarily having a full understanding that some people will not be engaging with the material that's being discussed, but they could be supported to engage with that material if there was somebody or a team member there to support them to make sense of what they're seeing or what they're hearing. The other really common area that where grading and adapting can be really fantastically done is around exercise. Now we recommend that exercise is completed a minimum really 2-3 times a week for people living with dementia in care settings, and a lot of providers will actually focus on exercise in the morning once every day, so they can allocate that as an activity. And you can grade and adapt that activity by having a team member support people on an individual basis during those sessions. The other area that I can't help but mention is the television. Now, the television is an amazing tool if it's used properly, but the risk with the television being on is that quite often it can be on as background noise, and nobody's watching it, nobody's engaging with it. It's not to say that the TV is not it's not to say that the TV can't be used as a useful tool, but be careful if the TV is on. Please, if you're on this call and your managers, or even if you're your team members, when you walk into your living space, you're walking into your lounges or your dining rooms, and the TV is on, please see if anybody is actually watching the TV or engaging with it. And if they are, that's great. If they're not, then think about and I've done this a number of times in homes, of actually turning the TV off or switching to music and really getting people to engage in their environment better. The risk with having the TV on is that it can be used as a background level of noise, and actually it's not being utilized as a tool. In the age of smart TVs, I think this is a really great development actually in care homes, that providers are investing in smart TVs, so they can then start to access different apps. They can start to access YouTube. They can start accessing things like My Life TV, which is a great resource that is developed specifically for people living with dementia in care environments. So think about how you're using the TV. Pillar 4, the enabling environment. So environmentally, every home is different. And so when we visit a home, we get an understanding of a space over a period of 2 days, and we try and understand how that space is used. Obviously, care homes are some are brand new, some are very old, some have had lots of adaptations, some are kind of converted older buildings, newer buildings. They're all very, very different. And there are some key what would be called dementia-friendly design principles that a lot of newer homes are being built based on those design principles, which is great. You know, University of Stirling have done some fantastic work on design. What I wanted to go through in this pillar and the next couple as well is some common areas that we will see where we would be supporting a provider to develop. The first thing you need to do really is think about the space that you've got, and does the space that you have give people different opportunities to engage, or if it's not appropriate for people to engage in a noisy space, do you have a space that is a quieter space that people can access? Again, every home is very different, but the important thing is, do you have spaces available? Yes, for people to have a living experience. Yes, for people to have a dining experience, but also bearing in mind that some people don't like noisy spaces. Do you have a quieter space that people can either access themselves or be supported by your teams to access? The other I'll whisk through a couple of quick wins, if you like, environmentally. One is around clocks. Often don't see digital clocks in living spaces and dining spaces. And also reasonably quick wins is around the decor that's on the walls, to make sure that what's on your walls is relevant to currently the people that are living with you, but also that might help your team and the people that are living with you to engage in their space, i.e., are there images of the local area, let's say? Are there images of, let's say, images of the people living in the home engaging with activities? And these kind of this kind of wall decor can really help support people to understand their environment, where they are, and also what they've done. You know, it helps them and it helps families to understand what's been happening in the home, rather than walking down a hallway that is, you know, has generic images or generic photos that don't orientate people to the space that they're living in. And again, in some homes, something to be focusing on is even making sure that there are things on the walls. Sometimes we do see that homes can be quite sparse in terms of the decor in hallways and in different rooms. So making sure there are bright images, there are things that people can be looking at, that they can interact with, that they can comment on when they're walking through from one room to the other, as well as understanding the space that they're in. Just quickly, I know people talk about it a lot. I will mention it because it is important. Signage is an important part of a dementia-friendly environment, although not everybody navigates through signs. Some people navigate through colour, so that's something to be bearing in mind. And some people also navigate through recognising certain objects, or recognizing certain things in the space that can help them orientate. It's called landmarking, but it's ways that people can identify where they are if they feel lost. Okay, the next area is the homely environment. So thinking about a care home being a homely space, in that it feels comfortable, it feels kind of nurturing, and it feels, as much as it can do, like somebody's home. Not clinical, not hospital-like, not everything wipe clean, but feeling homely. And I'll talk a little bit more about the senses and how that's done in the next section. But the homely environment is really important to make people feel comfortable. So that can be around making sure that there's a range of seating options for people, not just the standard winged back armchairs, that there are sofas that people could be using, different colors, different seating options to make sure that people have a choice of what kind of seat that they would like to sit on. Having things around them that are personal. Now, this is quite hard to do, but it is something that is important, particularly around orientation and comfort. Is when people are sat and they're in a living space, or they might be in a space that's not their bedroom, then to have things that are around them that are personal to them or that they can recognize, because this can really help someone feel reorientated, feel comforted about where they are, particularly if they can get anxious or distressed about where they're living. Another area that's really important to me, and I know there is an international movement called Open the Doors, and is access to the outside. Now, there's lots of evidence around the benefits for everybody about having access to fresh air, to sunlight, to natural objects, trees, plants, flowers, all these kind of things. So trying to be as open as possible to the outside. If you have a garden, using it in all weathers. I'm going to grab another book. I'm hoping you can see it on the screen. So an amazing lady called Debbie Carroll has written this book called Why Don't We Go Into the Garden? And this is a book specifically written for care providers who want to make better use out of their outside space. Of course, there can be times when there is an anxiety about using an outside space. And what Debbie's book does beautifully and it explains is that culturally it's important to recognize how the home supports people to access the outside. And if there is a perceived risk, or if there is an actual risk, then how can you go about supporting people to engage with outside spaces as much as possible? So that it's a really fantastic book to be reading, particularly if you want to try and use your outside space more. Having dining areas separate from living areas is important. This helps people, again, people's lived experience. It helps people have a living experience and a dining experience. There are some great, we can send you copies if you like. There are some great dining experience checklists that homes can use to support people living with dementia. So please do use a dining experience checklist. I have yet to see a living experience checklist. I'm sure there's some out there. If there isn't, I think I'll put one together, because sometimes the dining experience is considered, but the living experience isn't always considered as much as it can be. So I think for teams to be able to facilitate people's living experience is really important. And this pillar particularly relates to person-centered participation, because you create a homely environment that is person-centered, then you're going to allow people to participate with their environment better. No patronizing decor. So nothing fake. No fake bus stops, no fake shops, those kind of things. Yes, have a shop in your care home, but please use it as a shop. Don't just put a decal or a sticker on the wall that says shop, and hope that it will make a difference. I haven't seen those types of design make a difference, but absolutely do things that facilitate people's engagement. But in terms of decor, there seemed to be a kind of a bit of a boom sort of 10 years ago of bus stops and fake shops and things like that, but please take them down. The next thing really is around people's rooms and making sure they're as homely as possible. When people move in with you, then ensure with families that they bring as much of that person's things from their home into the care home, bring as much as possible, so that they can orientate themselves. It helps people to connect better with the world around them if they've got things that they recognize in their field of vision. But it also helps teams to understand the individual. If families and the people are bringing in things to decorate their room, whether it's pictures, whether it's their own cabinet, could be a desk, could be their own chair, it really helps teams to understand the person. So this kind of having personalized objects in a person's room is really important, both for them but also for the team. Okay, how are we doing for time? I'm going to keep going on the rest of them. I know we might not have time for questions, but I'm hoping this is of value, so I'm going to keep going. Light, sound, smell, and touch for well-being. This is pillar 6. I'm going to whisk through some of these. Some are fairly easy to remedy. Some are a little bit more challenging. One that is quite easy and relatively cost effective in this area is light. So as in light bulbs, so natural and unnatural light. So the benefits of natural and the right levels of unnatural light are really, really important for people living with dementia. And I tell people all the time, so on your smartphone, you can download a very simple app that is a light meter. It's not absolutely perfect, it's not a kind of professional light meter, but it will help you understand areas of your home that are dark, because this can really, really affect people's engagement with the space, particularly people who've got visual impairments. Personally, I've noticed it more. I've had an issue with my eyesight recently, and where I see dark areas within a care home, it really affects how well I engage with that space. And the providers that have increased their light levels, the magic number is 150 lux. If you can get up to that kind of level of light in social spaces, then this is going to help the people and your teams become more alert, engage with the space, and also understand what's happening in terms of daily living activities. So if you can assess and understand light, and particularly dark areas of living spaces, hallways, and very importantly, if you use them, stairs, it's a very big focus when we're delivering our assessment. Hearing loss. Now, everybody would be expected to make reasonable adjustments to their home if people are living with hearing loss. The thing to note around hearing loss, particularly for people living with dementia, and is in fact quite significant influence on memory loss as people get older, is trying to ensure that you have something in your home to support people's hearing. That can be a loop system. There are different technologies out there that can help you amplify the sounds of the team and people's environment. But if people's hearing loss and if people's hearing is facilitated and improved, then they will engage better with their space. And actually, there's a good evidence out there that it can reduce cognitive decline as well. And then the last point on this, on light, sound, smell, and touch for well-being, is air quality. Now, this doesn't necessarily mean that every home needs to install air conditioning, but one of the things to bear in mind particularly is access to fresh air, and this is much more important in the winter when things are closed because of the weather. That if you can think of a strategy to improve the amount of fresh air in your home, then this is going to impact people's lived experience, and it's going to support their well-being, and again their alertness and the people and the team's alertness during the day. Okay, I've got 15 minutes, so I'm hoping I've got about 10 minutes, and then we probably have 5 minutes of questions, or if not, you can always email questions. Team induction, training, and nurture. Now, this is quite a large section, so I won't totally whisk through this because there's lots of important points, particularly around I would say learning and development as well as training. I think there's a misunderstanding on sometimes that training is the answer to develop practice, and of course training is part of the answer, but learning and development and ongoing learning development is so important to support people living with dementia to live well in your setting. So yes, training on dementia care, yes, training on understanding distress and the psychological and social impact of dementia on people living in your setting. There are, and of course, training does cost money. Good training costs money, and the recommendation is face-to-face training. Another book I've got in my pile here to show you is a fantastic resource for any managers or senior leadership team to purchase: Education and Training in Dementia Care. So that's written by Sarah Jane Smith and Isabel Latham. Fantastic book that breaks down what works and what doesn't in terms of training in dementia care. Really great book. I just want to mention a couple of YouTube channels because YouTube is a resource that we fortunately do have now. There are some great resources out there, and there are some videos that are freely accessible. Ian James, who's written a lot on understanding distress in dementia care, has a YouTube channel that has lots of really great videos on. So do look Ian James up and see if you can find his videos, and then videos of people like Naomi Fell, David Sheard speaking. These are videos that are freely accessible on YouTube and can actually provide you and your team some insight about how to understand things like distress, how to understand things like people searching for in a kind of more feelings-based care. On that note, just around recruitment, because recruitment is part of this pillar, is recruiting your team members, and your team members being your main asset really in supporting people living with dementia, is really recruiting based on values and really focusing on team members' emotional intelligence. There are some specific tools you can use to understand people's emotional intelligence when you're recruiting them, such as the emotional and social competence inventory. You can use a specific tool like that, but you can also use some really simple ways of trying to understand somebody's emotional intelligence. Talk them through a scenario, a difficult scenario, or ask them a question around a scenario that's something that's happened to them that's made them feel that's made them feel anything. It's really about trying to recruit people who will have a feelings-based approach to their care, and emotional intelligence tools are a really good way of doing this. Another really quick one that works really well in this area, quick little strategy, is when people are interviewing, when you're interviewing people, take them around the home, see how they interact and engage with people. Are they stood around kind of rabbit in the headlights, or are they connecting with people? Are they engaging with people? Are they using those kind of non-verbal and verbal communication skills? The other focus area, there's two more in this area that I think are really, really important. One is language, and understanding that language can shape the culture of your home. There's some particular common phrases that we see still quite a lot particularly in care plans, things like challenging behavior, dementia sufferer, wanderer, is an aggressive person. This kind of language can label people, and I've read examples of care plans that are written, and I go and meet that person and I see someone totally different. So spoken language and written language is so important in shaping your culture. The other one you hear, the other phrase you hear quite a lot, which again is comes from hospital-like language, is the word unit. So dementia unit. So what we want to try and shape when we're working with a provider is developing your setting as a home. So making sure that it's very different from a clinical space. So language is really, really important. The other area that I haven't touched on, which I will just touch on quickly, is supporting families. And a really quick and easy way to support families who may be needing extra support and guidance is offering the Dementia UK helpline. So this is a free phone helpline that can support families, that is manned by Admiral nurses, so trained nurses that support people living with dementia and their families. 0800 888 6678 is such a great resource. That's that one. Okay, we've got 2 to go and we've got 8 minutes left. So team approach and emotional connection. I'll try and whisk through these so Martin can wrap up. But again, there's some really important things here that I want to go through rather than whisking through them too quickly, because I want you to leave with some as much value as possible from this session. So team members using every interaction as an opportunity for connection. This is something that we see quite a lot when we're observing a home, is team members not always connecting with people, particularly eye contact and touch if it's appropriate for that person. And so thinking about every interaction as an opportunity for connection, that is something that is a phrase, if you can remember that, and if you can get your team to remember that, this is quite a powerful way of trying to support your team to move away from a task focus and more towards a connection focus towards dementia care. So using eye contact, using touch, and gaining a person's awareness before you're communicating with them. So connecting with them with touch, so maybe touching their arm, connecting with their eyes and your eyes, connecting, saying their name. And this is and doing it slowly. This is just a very simple way of ensuring that that you have that person's attention and that person's connection before you then communicate to them. Two more things in this area. One is something to be mindful of around communication is what we would call overpacing. So this is speaking too quickly, too much information for somebody who might not be able to process that information. I'm probably speaking more quickly towards the end of this session because I'm running out of time. So there's a risk of me overpacing, but I'm trying not to succumb. So think about overpacing. It's the most commonly seen from our case managers, an issue where teams are speaking too quickly and they don't give enough time for people to process that information, which I think from what I can recall can take people up to 6 seconds, and 6 seconds is a long time if you count it. And then the final one on this area is making use of qualitative observations. Now, we as practitioners, as either occupational therapists or psychiatric nurses, we will be trained in how to use qualitative observations. So these are things like common tools being dementia care mapping. There is a great new tool that is the training is free, and it's called PORT, which is person-centered observation and reflective tool. And the rationale behind using qualitative observations, which is a fancy word for saying being a fly on the wall and kind of seeing what's happening, is it gives you either as a leader of your home, or even give the power to your team, the opportunity to understand how your team is connecting with people, how they're communicating with them, and it's something that can take 20 to 30 minutes to deliver an observation, a PORT observation. And the critical part of it is then you use that information that you've gained from that observation to reflect with your team about how you can improve. So look up PORT, a PORT tool. Again, anybody that's interested, I can send them this information afterwards. I'm sure the guys at Care England can pass on my email. And then the last section, vision, culture, and leadership. I'm going to whisk through these because I've got 3 minutes. Even if you're a small provider, think about having a strategy or a vision document for your dementia care. What do you want your dementia care to look like? Engage with the outside. Engage with your community. The best care homes that we work with are care homes, but they're also communities. So they're engaging with organizations, groups, clubs that are around them. So they're not closed, they're open, and they're developing communities. This is supporting people to be living well and to be engaging with their past experiences and hobbies. The last couple on vision, culture, and leadership. One is around the management team seeking out best practice. So looking at things like the Journal of Dementia Care, going to events, going to expos, going to Dementia Congress, things like that, is understanding that practice is always developing, new research is always coming out. So as a management team, if you're passionate about dementia care, you should be searching for new tools, new resources all the time. And then the last one is thinking about how you develop your team professionally. So thinking about whether the team requires extra training. Are we looking at level 2, 3? Whether we're looking at post graduate qualifications, is about continual development, continual interest, and fascination about how you can support people living with dementia. So that, I'm hoping I didn't overpace too much there. That is a summary of some of the areas that we see providers could be developing in terms of their practice. I've whisked over a lot of the areas, but these are the common areas that we see. And like I said at the start, I'm hoping that what I've said has given you some value, and if you can go away with three things of, okay, I'm going to look into this, or I'm going to change this, or I'm going to see if I can develop that, then that would that would mean that this webinar has been valuable to you and your teams, and the value then transfers over to people's lived experience. So that's everything from me. Back to you, Martin.
Thank you very much, Sam. And I thought that was a great run through of a lot of things that people can tangibly do to improve the lives of people living with dementia. My takeaways were about having a very person-centered approach, enabling people to live well and to focus on giving people the best life rather than thinking about the quality of the service. I know there have been some great things said in the chat. There are a couple of questions. I know, Millie, you had a couple of questions, and we haven't got time for those to be answered now, but we'll make sure that the answers are transferred to you after the seminar. I just want to thank you, Dan, for what you've given to us today, which I think is highly practical. I want to thank everybody who's given their hour to this afternoon. I think it shows that the care sector is really, really committed to delivering the best quality care and support for people living with dementia. So thank you, everybody, and we look forward to seeing you at the next seminar. Goodbye.
Thank you, everyone.
Thank you.